Praise be to Allah, the cherisher and sustainer of the worlds. I'm Dr. Amsha Mushtaq Khan, and today I have the opportunity to present on the topic of monkeypox under the kind supervision of Professor Dr. Saira Afzal. Quote of the day: everything begins with a thought, and thoughts are turned into plans, and plans into reality. Content outline: number one, introduction to monkeypox. Number two, dynamics of disease transmission. Number three, epidemiological determinants. Number four, clinical features and complications. Number five, prevention and control measures. Number six, current global policies and challenges, and recent advances and multiple choice questions. At the end of this presentation, the participants will be able to understand the epidemiology of monkeypox, including the phases of the disease, complications, and global prevalence, comprehend the dynamics of monkeypox transmission, including its reservoirs and modes of transmission, understand the prevention and control measures for monkeypox at various levels of prevention, and recognize the recent advances in the context of monkeypox. Monkeypox is an illness caused by the monkeypox virus. It is a zoonotic viral infection that is transmitted between people and occasionally from the environment to people via things and surfaces that have been touched by a person with mpox. In settings where the monkeypox virus is present among some wild animals, it can also be transmitted from infected animals to people who have contact with them. Following a series of consultations with global experts, WHO has begun using a new preferred term, mpox, as a synonym for monkeypox. The disease presents a significant public health issue due to its potential to cause severe illness and even death, particularly in individuals with weak immune systems. It is also a concern because of the potential for human-to-human transmission, primarily through large respiratory droplets. From a public health perspective, understanding and controlling monkeypox is essential because of its potential to cause severe disease and the increasing number of reported cases worldwide, especially in regions where smallpox vaccination coverage is low. Problem statement. Monkeypox was first discovered in 1958 when outbreaks of a pox-like disease occurred in monkeys kept for research. The first human case was reported in 1970 in the Democratic Republic of Congo. Within several years, human cases were found in multiple countries in Central and Western Africa. However, the world has seen nothing like the outbreak that it is now seeing internationally. The current number of confirmed cases in the past 4 months is 23 times more than all cases reported for the roughly 5 decades from 1970 to 2018, approximately 1475. Historically, outbreaks of monkeypox have been linked to animal-to-human transmission, and long chains of human-to-human transmission have not been seen, whereas for this current outbreak, we are seeing extensive human-to-human transmission, causing both the number of cases and the geographic spread in more than 80 countries to be unique. Also unique to this outbreak is that the available data indicates that it is predominantly spreading in Europe and the Americas, with less than 1% of current cases confirmed from endemic countries. This is the historical snapshot of monkeypox, where it is shown that the non-endemic countries have a percentage of 80% and endemic countries have a percentage of 8%. Monkeypox outbreak global and regional spread. The regional distribution shows that 70% of cases of confirmed cases of monkeypox are in Europe and 20% in Americas and less than 1% in endemic countries. Unique aspects of monkeypox outbreak. One distinctive aspect of the current monkeypox outbreak is who is being infected and the mode of transmission. Cases are mostly present in middle-aged men, 98 to 99%, and typically through sexual contact, almost 95%. Monkeypox is not considered a sexually transmitted infection. The virus typically spreads to anyone through close personal contact, often skin-to-skin contact, including direct contact with respiratory secretions, such as mucus or saliva or other skin lesions. However, in this monkeypox outbreak, contact during sex is the predominant mode of transmission. Also, the RO, or the reproductive number for men who have sex with men, is about 1 in countries with more than 1,000 cases. This means that each confirmed case within a high-risk population will currently spread to more than one other person on average. As with past outbreaks, this outbreak will come to an end only if the RO drops below 1 everywhere. Who is being infected in Europe thus far? We can see that 95% of the transmission is human to human via sex or other close contact. 98% prevalence, gender split shows the male predominance. HIV status almost 60%, and case severity, non-serious cases have been almost 94%, and 5 to 6% of cases required hospitalization, and less than 1% resulted in death. Understanding monkeypox. Symptoms in humans are similar to but milder than smallpox. These include fever, headache, muscle aches, backache, swollen lymph nodes, chills, and exhaustion. A rash then develops, often beginning on the face and then spreading to other parts of the body. The disease is usually a self-limited disease with symptoms lasting from 14 to 21 days. Severe and fatal cases have occurred in individuals with weak immune systems. The virus is transmitted to people from animals and spread among humans through respiratory droplets. Source and reservoir. The source of monkeypox virus is the monkeypox disease is the monkeypox virus from the family of orthopox virus. Reservoir are rodents, monkeys, and human cases. Mode of transmission is direct contact, ingestion of improperly cooked meat from infected animals, and human-to-human transmission. And susceptible host, anyone who hasn't been exposed to monkeypox or vaccinated against smallpox is at risk. Mpox spread through close personal, often skin-to-skin contact. The disease can spread through direct contact with rashes or other bodily fluids from an infected person by touching objects and fabrics that have been used by someone with Mpox or through respiratory secretions. Most confirmed cases outside of the endemic region in Africa occurred in young or middle-aged men who have sex with men or who had recent sexual contact with new or multiple partners. This figure shows the modes of transmission of monkeypox to humans. This is the primary transmission from the bites and scratches from infected animals, hunting, cooking, and consumption of infected animals, blood and bodily fluids, and contact with cutaneous and mucosal lesions. And then the secondary human-to-human transmission occurs through close contact, direct contact with cutaneous lesions, respiratory droplets, and recently contaminated objects and surfaces. This is the proposed pathogenesis of monkeypox. Now the epidemiological determinants. First of all, the agent factors. Agent is the DNA virus family, monkeypox virus from the orthopox virus family. Incubation period is typically 6 to 16 days following exposure, but can range up to 21 days. Period of communicability. Infected persons are most likely to spread the disease during the presence of the rash, which occurs from about 1 to 3 days after the fever starts until all the skin lesions have crusted. This is usually within 2 to 4 weeks after the onset of symptoms. Virulence and pathogenicity. The illness is less severe in people who have received the smallpox vaccine as it provides cross protection. The virus can survive for a few days on unanimated objects, especially when these are soiled with respiratory secretions, fluid from skin lesions or feces. Host factors, susceptibility. People not previously exposed to the monkeypox virus or vaccinated against smallpox are more susceptible. Immunity against monkeypox may be derived from a previous monkeypox infection or to some extent from vaccination against smallpox. Children appear to be more susceptible than adults in the previous outbreaks, possibly due to less prior exposure or lack of smallpox vaccination, and people with weakened immune systems may be more susceptible to severe disease. Environmental factors, geographic location. Monkeypox is endemic to the rainforest regions of Central and West Africa, but the recent outbreaks were different. Animal reservoirs, the virus is believed to be maintained in nature by several rodent species. Socioeconomic factors, conditions of poverty, malnutrition, high population density, poor sanitation, and lack of healthcare can all increase the risk of monkeypox transmission. Some studies suggest that monkeypox may be more common in certain times of the year, likely due to changes in human activities and animal behavior. Clinical features. These are the non-specific symptoms and complications of monkeypox. The non-specific symptoms include fever, headache, myalgia, backache, lymphadenopathy, chills, exhaustion, rashes, and mouth and throat ulcers. And complications include bacterial superinfection, corneal infection, which can be permanent scarring, bronchopneumonia, sepsis and septic shock, cellulitis, respiratory distress, and encephalitis and dehydration. Monkeypox is a viral disease that causes symptoms similar to but milder than smallpox. The disease typically occurs in two phases: invasion phase from 0 to 5 days. The onset of monkeypox is typically abrupt with non-specific symptoms, and then is the skin eruption phase within 1 to 3 days after onset of fever. This phase typically begins with a rash, often starting on the face and then spreading to other parts of the body. The progression of the rash stages is the illness typically lasts 2 to 4 weeks. Swear and fatal complications occur more commonly among individuals with weakened immune systems. Prevention. First of all, the primordial prevention. This involves interventions to minimize future hazards to health and hence inhibits the establishment of factors that may increase the risk of the disease, which includes public health education to increase awareness about the disease, especially in areas where the virus is endemic. Enforcing regulations to reduce the interaction between humans and wildlife, which are potential carriers of the virus. Now, the primary prevention, which includes measures to prevent the occurrence of the disease, it includes vaccination. The smallpox vaccine has been shown to be approximately 85% effective in preventing monkeypox. Vaccination is usually offered to healthcare workers and others who are likely to come into contact with infected animals or monkeypox patients. Avoiding exposure, the public should avoid contact with animals that might harbor the virus, especially in regions where the monkeypox is prevalent. This includes not keeping these animals as pets. Food safety, all meat should be properly cooked, especially in regions where the disease is prevalent. Hand hygiene, regular hand washing with soap and water is an important preventive measure. Secondary prevention, active surveillance and rapid response, rapid identification, isolation, and treatment of the infected individuals to prevent the spread of the disease. Contact tracing is essential in this regard. Personal protective equipment, healthcare workers should use PPE when caring for patients with suspected or confirmed monkeypox. Tertiary prevention. While there is no specific treatment for monkeypox, care is supportive. This includes managing fever, providing hydration and nutrition. Pain relievers can help with the discomfort from the rash and management of complications. Serious complications of monkeypox, such as bacterial infection of the skin or eyes, pneumonia or encephalitis, should be managed promptly and aggressively to minimize the long-term impacts. The primary modes of intervention for monkeypox are vaccination, public health education, surveillance and contact tracing, isolation of the infected individuals, provision of PPE for healthcare workers, and management of complications. Vaccine recommendation. The latest vaccine recommendations for monkeypox are as follows. The vaccine used to protect against monkeypox is Jynneos, which is a 2-dose vaccine also developed to protect against smallpox infections. Both doses are necessary, with the second dose given 4 weeks after the first dose. The vaccine can be administered in 2 ways, intradermally or subcutaneously. Both methods seem to be equally effective. The CDC recommends vaccination against monkeypox if there was a known or suspected exposure to someone with monkeypox. The person had a sexual partner in the past 2 weeks who was diagnosed with monkeypox. The person is at high risk due to their sexual behavior or work settings. The person has HIV or other causes of immune suppression and has had recent or anticipates future risk of monkeypox exposure. The vaccine should not be given to those who have had a severe allergic reaction, such as anaphylaxis, after receiving the first dose of the Jynneos vaccine. Extra caution should be taken if the person had an allergic reaction to any vaccine, and they may still be vaccinated with, Jynneos, but should be observed for 30 minutes after vaccination to ensure no allergic reaction occurs. Recent updates. The changing epidemiology of human monkeypox, a potential threat. The number of human monkeypox cases has been on the rise since 1970s, with the most dramatic increases occurring in the demographic. This review shows an acceleration of monkeypox cases, especially in the highly endemic DRC, spread to other countries and a growing median age from young children to young adults. These findings may be related to the cessation of smallpox vaccination, which provided some cross protection against monkeypox, leading to the increased human-to-human transmission. The appearance of outbreaks beyond Africa highlights the global relevance of the disease. Increased surveillance and detection of monkeypox cases are essential tools for understanding the continuously changing epidemiology of this surging disease. Risk of resurgent mpox outbreaks warrants increased prevention effort. CDC continues to assess that the risk of resurgent mpox outbreaks is substantial in the United States, although the daily number of reported mpox cases has fallen dramatically since August 2022. The diagnosis of several unlinked cases each week and intermittent wastewater detections across jurisdictions are consistent with ongoing undetected transmission. The risk of outbreaks could further increase as people gather this spring and summer for festivals and other events with high potential for skin-to-skin contact or increased sexual activity. Healthcare providers, public health agencies, and partner organizations should help ensure disproportionately affected populations, currently gay, bisexual, or other men who have sex with men, and transgender people, to have access to vaccines, testing, and treatment. People at risk for mpox exposure should be vigilant of the possibility of community transmission, take steps to reduce the risk of infection, and seek vaccination. This is the recent resurgence risk likely substantial. A recent uptick in mpox cases in Chicago that began in mid-April underscores the risk of renewed mpox outbreaks, which is judged as substantial across the United States. Based on the following factors, the confidence is moderate. The virus continues to circulate in the United States. Skin-to-skin contact or sexual activity may increase around large spring and summer gatherings. Mpox vaccination coverage is probably too low to prevent outbreaks in most jurisdictions. And the mpox vaccine protects against disease and reduces the risk of severe outcomes in those who get infected, but it is not 100% effective. Recommendations: currently gay, bisexual, and other men who have sex with men make up the majority of mpox cases in the United States. However, anyone who has been in close personal contact with someone who has mpox is at risk. MSM and transgender people who have sex with men should stay up to date on the mpox news. They should get vaccinated if they are at risk of mpox exposure, which includes both doses of the mpox vaccine. If a person has a new or unexplained rash or other symptoms, follow safer sex and social gathering practices and seek testing regardless of the vaccination status. While vaccines are effective at protecting people against mpox, they are not 100% effective. It may also be possible for people who already had mpox to be infected again. Follow other prevention steps to prevent themselves from getting mpox, including avoiding close skin-to-skin contact with people who have a new or unexplained rash. Healthcare providers should be aware of the potential for new mpox outbreaks and the latest testing and treatment guidelines. They should also test the patients if they have symptoms of mpox, regardless of the vaccination status. Rapidly report all cases to local public health officials, which is an important tool for preventing onward spread, since even one case of mpox could suggest ongoing transmission in the community. Now the multiple choice questions. Number 1, a 32-year man presents with fever, headache, muscle aches, and a rash that started on his face and is spreading to other parts of his body. He recently returned from a trip to Central Africa. Of the following diseases, one that should strongly be considered in the differential diagnosis is A. Lyme's disease, B. Malaria, C. Zika virus, D. Monkeypox, and E. Yellow fever.
D.
Yes, the answer is D. Monkeypox. A wildlife photographer plans to photograph a variety of animals in their natural habitats. In terms of disease transmission, the most likely animal to transmit monkeypox to humans among the following is A. Dogs, B. Cats, C. Rodents, D. Cattle, and E. Monkeys.
E.
The answer is C. Rodents. Number 3, a doctor examines a patient in a medical OPD who is showing signs of fever, fatigue, and a rash, leading the doctor to suspect a monkeypox infection. Of the following, one not a common symptom of monkeypox is A, fever, B, myalgia, C, cough, D, diarrhea, and E, rash?
D.
Yes, the answer is D, diarrhea. Number 4, a public health official managing a monkeypox outbreak in a town holds an educational meeting for local healthcare providers about the proper disease control measures. Of the following, the measure that would not be a recommendation is A, promotion of safe sex practices, B, avoidance of bushmeat, C, administration of smallpox vaccine, D, raising awareness about the sources of infection, E, using of personal protective equipment by healthcare providers.
A. B. B.
Yes, A. A is the right answer. An unvaccinated healthcare worker in a hospital has been exposed to a patient with confirmed monkeypox. The most appropriate course of action is A, the healthcare worker should immediately receive the smallpox vaccine. B, the healthcare worker should be placed on leave until they show symptoms. C, the healthcare worker should continue working but wear a mask at all times. D, the healthcare worker should be quarantined for 21 days. And the E, a healthcare worker should receive antiviral medication as a prophylactic measure.
A.
Yes, the answer is A. A nursing staff is providing care for a patient diagnosed with monkeypox in a hospital isolation unit. Of the following one, not a known route of human-to-human transmission of monkeypox is A, respiratory droplets, B, direct contact with blood or bodily fluids, C, contact with lesion materials, D, monkey bite, and E, contaminated bedding or clothing.
D.
Yes, the answer is D. In response to the monkeypox outbreak, the public health authorities should avoid against which of the following practices? A, importing exotic animals as pets. B, consumption of bushmeat. C, close contact with individuals showing symptoms of monkeypox. D, use of personal protective equipment while handling suspected cases. And E, administration of a smallpox vaccine.
A.
Yes, the answer is A. Number 8, a nurse is collecting samples to confirm a suspected monkeypox case. Of the following, the most ideal samples for monkeypox virus detection is A, urethral swabs, B, buccal swabs, C, throat swabs, D, skin lesion swabs, and E, rectal swabs.
D.
Yes, the answer is D, skin lesion swabs. A team of healthcare professionals is dispatched to a remote village due to an increase in reported fevers and unknown rashes. Of the following, the most likely factor to increase the risk of a monkeypox outbreak in a human population is A, high prevalence of HIV/AIDS, B, low vaccination rates against smallpox, C, high mosquito population, D, prevalence of a large number of domestic animals, and E, poor living conditions.
B.
Yes, the answer is B, low vaccination rates against smallpox. Number 10, a patient in the United States has been diagnosed with monkeypox, but he has not traveled recently or been in contact with any known cases. Of the following, the most likely source of his infection is A, contracted the disease from a mosquito bite, contracted the disease from an infected rodent, C, contracted the disease from eating undercooked meat, D, contracted the disease from a tick bite, and E, contracted the disease from a domestic dog or cat.
B.
Yes, the answer is B. This is the key of the MCQs. This is the link of the YouTube channel, and thank you very much.